afternoon, everyone. It's Wynn Brown at Heywood Healthcare giving our weekly update for the week ending this Friday, January 14th. Heading into a holiday weekend for some, a very cold day tomorrow, so everybody please be aware of that as you're making your plans. Skipping right to our COVID update, which we usually kick off with. We have 35 COVID positive patients in our system. That is not a record high for us, but very close to the top, and our ICU is full. Looking at our testing that we do regularly, we are just shy of having done 140,000 tests here. Our positive rate overall is 8% throughout the pandemic, 2+ times the state average, and our 7-day rolling average, remember that's just the testing we are doing here, is 33.88% positivity versus the state just under 23%, so we continue to be high. There's a chart here for everybody to see what it looks like, and it is super high. So please do everything you can to stay safe and get vaccinated. Speaking of getting vaccinated, there is a vaccine clinic Tuesday, January 18th at the Athol Senior Center from 10 to 2. You can call the Council on Aging at 978-249-8986. Just remember, if you've already had your first vaccination or more, to bring your health insurance and vaccination cards. So make sure you bring your vaccination cards with you so that can be updated. We have a lot of community announcements. Just the first is regarding our urgent cares. We are testing a lot of patients there for COVID-19. And remember, you really should only be going to get there tested if you have symptoms. And if you're not symptomatic, you really should get a home test or call your primary care physician to see what you need to do. Obviously, we have a lot of pressure on our system to make sure that we get vaccinations done, and it really has, one of the things it has done is it has stressed our phone system in the health system. On Monday, we had nearly 500 calls alone just to our Damon testing center. And remember that we only have 4 people working there, and those are the people that are also doing the swabbing. So we have 2 people working the phones. Staff's doing an outstanding job. Please be patient, please be kind, but just know that our phone system is a bit overwhelmed given the resources that we have. So remember, first call is to your PCP to see what you should do, and then go from there. We've also been working closely with our delegation, legislative delegation, to improve testing capacity in our region, and the Heywood Medical Group and Gardner area practices were provided rapid testing kits by the City of Gardner to help address the testing crunch situation. Thanks to Mayor Mike Nicholson and Representative John Zlotnick for delivering those tests earlier this week. We also continue to work with we've got a great legislative delegation, and they've been listening to us and working with us to try to improve the situation with our workforce challenges that not only the Heywood has, but everyone is having right now. We've requested additional National Guard, so hopefully we'll be able to get some National Guard, especially at Athol, which does not have any, one of the few hospitals in the Commonwealth that does not have National Guard residents right now. Looking at the challenges presented by the traveling nursing agencies that are charging exorbitant pricing to hospitals for staffing. Actually taking our staff who are going to work for some of them. It's happening at every hospital in the Commonwealth. It's like robbing Peter to pay Paul. And then the state has money for hospitals, part of the ARPA money it received from the federal government, and we're trying to get those dollars released, and that would help Heywood because our cash flow is incredibly challenged right now. So our senators, Goby and Comerford, our representatives Whips and Zlotnick, and their aides, and Mayor Mike Nicholson have all been incredibly helpful to us. So I just want to give a shout out to our delegation and let them know that we appreciate everything they're doing to improve the healthcare and support the healthcare as we really work very hard. We have 54 staff out today COVID positive, and we still have over 200 positions open, and we are doing everything we can to just make sure that we can keep our services staffed. And just a shout out to our staff who are picking up overtime, extra shifts, working very hard to make sure that we can do that. There have been some questions from staff around our behavioral health unit. As you know, the MHU, our mental health unit, is still closed. We have been trying to attract and hire staff to work there. We actually received a grant of $240,000 from the state. Each hospital that has behavioral health services received that to try to incent and retain behavioral health staff. And I think there is some confusion out there. Well, how can you have a $15,000 signing bonus for a nurse on MHU, but it's only $3,000 in other parts of the hospital? It really, or the health system, it is because that is state money exclusively for that one thing. So it's not necessarily Heywood's money, it's the state money to try to support behavioral health services. There's been closures at 38 site facilities in the Commonwealth, and for those of us who work in healthcare know that we're stressed across the board, but behavioral health access is incredibly hard to come by. So we're trying to reopen MHU and support GPU, and that's with state money. Thanks to our delegation for doing that. Just a reminder, I already mentioned it, it's going to be a wicked cold day, as we would say, where I grew up in Maine. Tomorrow, we might get some snowfall as well, so please be prepared for that. And also tomorrow, Saturday, the 15th, our draw room, our lab draw room at Heywood is closed for the day. It's a one-time thing. It has to do with another situation going on where everybody's going to be attending a funeral, and we wanted support staff who wanted to support their colleague to do that, so we are doing that because that's what community hospitals do. And just an internal announcement, HR has asked and finance has asked that everybody look online at your benefit deductions. There's been some challenges with the vendor we use on that, and as you know, we're running still on Chronos manual, so please hop online and take a look at your pay stubs just to make sure we're getting the deductions and everything right in the beginning of the year. And so please do that. There was an email that went out earlier this week that shows you how to do that if you don't do it very often. And just to end on a high note, we had 4 really nice promotions this week at Heywood Healthcare for directors. So Annette Calder, who leads Watkins 2 for us, has been named a director. Karen Ostacki on Watkins 1. Maureen Donovan has been promoted to lead as a director of telebehavioral health and school-based services. So that school-based service piece is an addition for her. And Kelly Kacholfi is now our director instead of manager of marketing communication. And she is filming me right now, so she's working hard. So thank you everybody for all you're doing. Please stay safe, do everything you can to say thank you to our staff, be kind to our staff if you're coming to get services from us, because it's incredibly stressful for them right now, and we need patience and loving kindness right now. As we head into the weekend, as we continue to journey to be one of the best community health systems in America. Thank you.